Good evening. Thank you very much. I've had the distinct pleasure over the last 4 years of being charged with stewarding Oliver's vision for our substance use disorders portfolio, and it's my deep honor to be able to take a few minutes and talk to you about it tonight. As I thought about what I could say to share Oliver's impact in this arena, I felt it best to think about Oliver. Oliver would sit at his kitchen table as he was thinking about this issue and write handwritten letters to Lou Feldstein at the foundation at the time. He'd clip out newspaper articles, an article in the Keene Sentinel about rising alcohol use among young people, an article from the Boston Globe about the growing heroin problem that was coming out of the urban centers and coming into rural areas like the western part of the state. And even knowing the scale of what Oliver could give, he asked a very specific question. Can I really make a difference? Addiction is a complicated disease. It is a disease, a disorder that's based in the brain, that has with it genetic precursors, family history, and environmental factors. But a lot of people don't see it as a disease. They see it as a moral failing, bad behavior, a bad person. And so for the thousands of people in the United States and in New Hampshire who struggle with addiction, they've often struggled in silence, without the ability to access treatment, without the ability to get back on their feet again. Oliver knew this and wondered, even with his scale, again, the second largest portfolio of funds the foundation has, $40 million of our assets are from Oliver, is that enough to make a difference? So I thought that in sharing with you what we've been able to do and where we're going with this work in the future, I'd tell you what I would tell Oliver if he was here tonight. Oliver's investment is $40 million. The grant-making dollars that came out of that investment in total, since we received that fund in 1997, roughly $16 million. The amount of money, public funding leveraged with that $16 million right now stands at $58 million. $30 million of that is funding from the state of New Hampshire. You may have noted Charlie commenting that at the time Oliver made his decision, the state of New Hampshire spent almost no money on substance use disorder treatment or prevention. To be exact, they spent $25,000 a year. Since 1997, with the Alcohol Abuse Prevention and Treatment Fund, a hallmark policy victory of the New Futures organization that Oliver founded, $30 million in state funding, proceeds from the sale of our state liquor stores, now goes into prevention and treatment. The rest of that money, federal dollars leveraged, other private investors, other donors who have followed Oliver's vision into the future. But it's not just about money. This is a disease that impacts people. What we can tell Oliver today is that since the establishment of his fund, 1,700 people in the state of New Hampshire have received treatment who otherwise would not have because of our adolescent treatment initiative and our grants program targeting treatment for reentering offenders. So more than half of that 1,700 kids, children, in the throes of addiction at a critical point in their life. We cannot begin to quantify what the availability of treatment for those young people has had on their lives as they move into what we hope is a healthy adulthood. And rates of substance use across the board in our young people, they're dropping. In some ways, not as much as we would like, but they're beginning to drop. Again, because of a commitment to policy and advocacy, to evidence-based practice, to smart grant-making, and close partnership with our partners in the public sector and nonprofits in the community. Now, there's something I could not tell Oliver tonight. I can't tell him that the problem has gone away. I can't tell him that we've reduced use to zero. I can't tell him that there are still not lines of people in the state of New Hampshire waiting for treatment who are having trouble getting it. In the state of New Hampshire right now, we estimate that about 130,000 people, 10% of our population, meet the criteria as needing some form of support around the misuse of substances. And yet, our treatment system can only treat between 6 and 10% of them. So there is a lot of work to celebrate, but there is a lot of work to do. And therein lies Oliver's genius, because he understood that this was not a problem of today that could be solved overnight. It's not just about a good grant to a good program in a single year, but sustained focus and support on this issue that could drive change. So tonight, we're announcing the closing of that chapter, celebrating the successes of what we've done to date, and opening a new one. This year, our board of directors and the foundation has made a commitment to invest $12 million of the grant-making funds from the substance use portfolio over the next decade to build and sustain a comprehensive delivery system for substance abuse prevention. Because addiction is a treatable disease, but it is also entirely preventable. We're going to do that in close partnership with the Department of Health and Human Services, an unprecedented public and private partnership where our dollars will be leveraged with the dollars that the alcohol fund produces, that the state receives from the federal government, to build a comprehensive system that is statewide but local. Sound familiar? We're going to do that through 10 regional prevention networks. And you may find tonight that at your table sits one of those coordinators, nonprofit leaders, healthcare experts who understand the ground in their communities and know what needs to be done to turn the needle. We couldn't do something like this without a fund like Oliver's. We couldn't amass the kind of social capital we've amassed, the leaders who have stepped forward on this issue, without one man sitting at his kitchen table, writing a letter to Lou, thinking there has to be a better way. So the question that Oliver would ask if he were here tonight, have I made a difference? The answer is yes. Unbelievably, undeniably, absolutely yes. And this is just the beginning. Thank you.